once they arrive to MedStar Washington Hospital Center, we are dispatched through a call service. The patient is seen, minimal questions are asked. The intent is not to re-traumatize the patient by having them restate what happened to them. We don't want them telling the triage nurse all the details, and then the medical student, and then the resident, and then the attending physician. No, we don't do any of that. They triage nurses ask bare minimum questions, and then we're paged out. And then at that point, they tell their story to do our medical assessment and gather the past medical history, and then the reason why they're there, their current complaint. The wonderful thing today is that our patients have so many choices that they can make. They have so many options. They don't have to choose. I sort of, when I'm explaining it, I say it's like an a la carte menu. You can have forensic photography done for documentation purposes, or you don't have to have photos done. You can have evidence collected, or you can have just the medical portion of the examination. You don't have to have it all. Sometimes all those choices are also a struggle for the patient to make, trying to figure out what's best for them, but then we're able to talk through those options with them and help them understand what that really means.
I just want you to know that all of this exam is completely up to you. So if at any point there's something that you no longer want to do, or if there's something that you do want to do, you just let us know. Also, if you need to take a break or if you have any questions, you can always let us know.
Okay, thank you.
Now we can do photos of kind of your arms and your legs. Do you want photos of your vaginal area taken? You can think about that. We're not there yet. So if you want to think about it for a few minutes, it's fine. Okay. Sometimes those may end up, if you decide to report, those may end up in court. So I can't guarantee that they won't. So you can think about that if you want. But are you comfortable if I take a photo of your arm?
Yeah.
Okay. All right. So we'll do that in a few minutes. Do you remember what happened here at all? No? Okay. All right. Any other pain on this arm? Does it hurt to move it? Or just to the touch? Okay. All right. Okay, great. Get one a little closer. I'm going to get one with this measurement, so we know about how big it is, and then one without. Great.
It kind of feels weird.
Feels weird, yeah. I know. Feels a little bit strange. Okay. Any pain with any of that?
No.
Okay, all right. I'm going to go ahead and swab your neck. The swabs are a little bit wet on the end of them. This is just because you can't remember what happened last night, which is fine. We just want to see if we pick up any evidence on your neck, okay? So, as I said, these will be a little bit wet. Great, thank you. You're all done. Good job with that. I know that was hard. So from here on out, what it looks like, I'm going to go finish up some charting and sealing up the evidence. Chris will talk you through some of the resources and options, and then we'll get you your medications, and then we'll get you home. We'll go ahead and call it.
Yeah, we can get you transportation home if you need it.
Okay. We're in a position now where we just have really, really clinically skilled, experienced forensic nurse examiners that are top rate. And DC is leading the way in forensic nursing care in the United States. And that's a really awesome place to be. And we're always looking for ways to improve. Really happy that we've been able to kind of create this core group of nurses that ultimately can really focus on their forensic education and the forensic care that they provide, which makes it one of the best experiences that a patient can have after such a terrible assault.